Hello, everyone. As Marlon introduced, we will be conducting this program in a bilingual manner in English as well as in Sinhalese, because our main audience is Sinhalese and Sri Lankans who would speak and understand Sinhala probably better than English. I know that there are a few who have joined from overseas who are mostly Sri Lankans, so that I'm sure they could follow us as well. We at VIDA, we've been treating a lot of fever patients. Fever patients are mostly now COVID patients. And we have realized that there is a huge need, and there are a lot of primary care visits presenting to us due to post-COVID symptoms and syndrome. The syndrome is a collection of signs and symptoms, so that we can address those easily by educating the public. And I'm sure there are so many from outstations where they don't have access to medical facilities, and also going to reaching medical facilities at this stage is a bit of a concern, because anybody who goes to a medical institution thinks twice because of the risk they take by exposing themselves, especially the senior citizens who are more vulnerable for complications of COVID. සුබ දැසනක් පිටුවත්නි මම මේ අවස්ථාව ප්‍රයෝජනයට ගන්නවා සියලු දෙනාව යම්කිසි පමණකට දැනුවත් කරන්න. මම ඒ නිසා Sinhalese. I'm going to talk to you in Singlish so that everybody understands my limited ability to express myself. COVID, now we'll get into subject matter. COVID is there are so many myths, there are so many social media stories going about treatment, management, and so on, which has confused the general public mostly. So we thought that we will try to help you by educating you and enlightening you to an extent where you can manage things by yourself with a little bit of good knowledge about COVID and its post-COVID syndrome. As you are well aware, COVID is just a mild viral fever for most of us. People who have suffered know that very clearly. Post-COVID symptoms are concerns mainly because of the psychological phobia they are introduced to by the social media and the media itself. As you are aware, Sri Lanka has hundreds of thousands of cases, and most of them, about 80% of them, get better within weeks of illness. Post-COVID conditions are a wide range of returning, ongoing, and new health problems, which they experience after about 4 weeks, or which goes on beyond 4 weeks. That's the concern we have. And if I talk about the symptoms they mostly present with and the complications we have experienced, the ones that are difficulty in breathing or shortness of breath, tiredness or fatigue, symptoms that get worse after physical or mental activities. People who work, who hold responsible jobs, who strain their brains, they come into a brain fog, which is difficulty in thinking or concentration, cough, chest or stomach pain, headache, palpitations, which is fast beating or pounding heart, joint and muscle pains, pins and needles feeling, diarrhea, sleep disturbances, fever, dizziness on standing, lightheadedness, skin rashes, mood changes, change of smell and taste, and even change of period cycles in females. So there are so many symptoms involving many systems in the body, and post-COVID conditions now are known as post-COVID syndrome or long COVID, chronic COVID. So there are different definitions given. Now, when we were introduced, we were introduced as expert panels, panel of people, but there are no experts in COVID yet. COVID is still being studied and understood by the medical profession. So this little knowledge we are trying to give you is through experience by treating hundreds of fever patients in our personal protective equipment, PPE, and also by finding that most of them are COVID positive. And lately, when they recover, when we treat them as primary care physicians. Scientific knowledge is still limited. That we need to understand. And there are multi-organ system effects of COVID-19 have been documented. Cardiovascular, meaning related to heart and the coronary arteries. Pulmonary, meaning the chest, lungs. Renal, meaning kidneys and kidney related. And dermatological, neurological, and above all, psychiatric issues. So there is a wide variety of health effects which can persist after the acute illness is resolved. That is pulmonary fibrosis, myocarditis, type of extreme conditions where specialized care is needed also are among these. I'm talking about it from the primary care physician's point of view. And I want you to know that these are very common conditions, and there are so many who get affected and present to us with those. Most of them are respiratory symptoms, and we've got some people who can help the general public by educating them on certain aspects. So that I'm making this opportunity using our VIDA team to do this as a CSR project where we can help people by enlightening them and allowing them to have some knowledge and to understand that this is nothing to worry about. This is very normal after COVID. As I told you, most of the symptoms are respiratory related. It's tiredness, exhaustion, lifelessness, joint issues, muscle pains, fatigue. All that is, I feel, more could be handled by a good physiotherapist or a good strength and conditioning coach. So in our VIDA team, we have a Sri Lanka Sports Ministry approved strength and conditioning coach, Nigel Aaron. Mr. Nigel Aaron has been putting most of the international sportsmen on track when they had issues. And he is willing to join us on this mission to help the present requirement and the educative part of enlightening people who have these post-COVID concerns. Nigel is also a 360 coach from Kansas University. I'm going to make Nigel do some demonstrations and educate you on the physical training aspect of post-COVID concerns and conditions. Let me introduce Nigel. Nigel, over to you. I want you to do the demonstrations and take over from now onwards.
Thanks a lot, Doctor. Hi, my name is Nigel. Hope everyone stays safe and stay fit. And why I want to talk with Doctor and with the team that why we should do something like this. Mostly it came into my mind when I had my own friends suffering from COVID and trying to restore and coming back to their normal lives. So with the help of the media team and with the consultation of Dr. Galapati, so I'm going to do a few demonstrations, and you can, even if you're currently suffering right now, or even if you're currently recovering, maybe if you're okay to do it on your own, or if you want okay to do it with someone's guidance, I would most welcome you all to do it. And the same way, if there are any medical support that you have already been given to follow, please do follow them. Okay. So Dr. Galapati shared on many things, so I'm not going to touch more on speaking, but I'm going to cover a little bit of things like why does physical therapy needed when you are infected with COVID and to recover? Why does it needed? As doctor said, you need to restore the functions of the muscles and then reduce the likelihood of the mental health and the stiffness and the immobilization of muscles of coming back to your normal ways, like, you know, with the joint pains or the muscle stiffness, how you're going to get movement back into your body to get back to your normal life. And then with that saying, what mostly we need is, there are two segments when you get COVID. There are two stages. One is the stage where you're going to be bed resting, and the stage where, you know, after your 14 days or 21 days, whatever is over, in your day-to-day work, how you're going to come up. So first, I'm going to teach you the main issue. About 80% of the issue is when someone gets COVID is the shortness of breath, as doctor said. So I'm going to introduce and I'm going to demonstrate a few short to how to improve your breathing, and we will do a full video on it. So stay tuned with the video, with the YouTube channel and Instagram, because we have a very limited time. So I'm going to show you some of the basic things that you all can do. So starting off, so what you're going to do, I'm going to sit on the bed here. So always, I want you all to have the upright position. Now we say, in case if you are not able to do it on your own, then I would suggest you to have your bed. If you have bed raisers at home, even if you don't have it, have your bed, maybe put a cement block and lift it to 30 to 60 degrees, because lying flat, unless you're medically advised, lying flat, it will not help you to get enough oxygen to your lungs. So always you need to have that uplift and the rise of the bed. But if you are not access to any of those, I would like to show you how you're going to do this by placing the pillows like this, one on one on this side, and one on top. And then how you're going to lie down is gently come up, chest head back, slightly turn to your side, and slightly rest like this. So you have your body open. Don't take too much strain into your back and stay relaxed, and try to place your arms out so your lungs and chest is open. That's if you're lying upright on the bed. Okay, now for the deep breathing. First, I want you all to place your hand right below the rib cage. This is where all the air transformation is happening. Right below, what you do is slowly compress it and take a deep breath. When you take a deep breath, you might feel like your hand about to expand. That's what's the expansion only we are looking for. The air to expand, and then so what you're going to do is breathe in and slowly release from your nose and mouth. Now, if you are having shortness of breath, you might not be able to do it as deeply as you should, but it's okay. You can always take a breather, take a rest, and repeat it again. So you do this twice. Breathe in, expand, release. And in the same way, if you can hold your breath for a certain period, please do that. And if you're coming from shortness of breath, if you might get like a little bit of a cough, that's okay. Because your body is rested, you are affected with COVID, but then again, stop, rest, and repeat it again. So this deep breathing exercise, I want you to do maybe twice. Start with, and then repeat it 3 to 5 times, maybe every hour, every 2 hours, depending on how you can handle your body. If you are a person who is unable to move, then what you should do is you probably lie down on the bed and get someone to hold your diaphragm and breathe in and breathe out. Now in this, what we try to do is, we are trying to get the circulation, the blood circulation, and get the fill our lungs with oxygen. So that's why we need to do these deep breathing exercises. And in the same way, I'm going to teach you if you run out of breath while you're sitting. So I placed a chair here. So what you're going to do is, so if you're always sitting and if you're running out of breath, if you're having shortness of breath, always lean forward, placing your forearms on your knees. And deep breath in and out. And there's another position. What you can do is you can place your hand on your chin. Breathe in, breathe out. Do this 3 to 4, maybe 3 to 5 times. This will help you all to catch your breath and come back to a normal state. But these are not things that you will be doing 1 or twice a day or a week to recover. These are things you have to do for a prolonged period until you get back to your normal routine. And now I'm going to show you if you're standing. And if you're standing, maybe say you're back in normal and you're doing your cooking and you run out of breath in the kitchen. What you do is in a standing position, place your arm on a table, and then maybe in a slightly bend your knees, or maybe in a lunge position. Once you brace it, while you brace your arm, you're expanding your chest. And you breathe in, breathe out, just you're getting shortness of breath. Now I'm going to show you, this is, I think, mostly need to be advised and mostly need to show awareness, especially sleeping positions. Sometimes when we are tired and when we, after affecting with COVID, when we very lethargic, we try to stay in the sleeping position for a long period of time. So what we do is, we shouldn't do that. If you're sleeping, it's different. I'm talking about daytime resting. So if you're resting, try not to stay in the same position for more than maximum try to stay within 1 to 2 hours, not more than that. Okay. So always, if you have now this position, if you're sleeping on your belly, if you have not eaten, if you don't have any diarrhea or if you are vomiting, please don't stay in this way. But if you have none of this, if you're not eaten, as soon as you eat, don't try to sleep in this position. One of the best ways to get oxygen to the backs of your lungs is always to sleep in a position. So what you do is, if you can do it on your own, do it on your own. And if you're not, of course, you will need assistance. So what we're going to do is, so I have folded few sheets, or you can fold it 2 towels. Get a thickness of this for your head placement, and then this is for your legs. So what you can do is you can turn down, keep your head and leg slightly, lift it a little bit like this, and on your back. And if you have another folded towel, try to keep it under your hip. So it will keep your spinal cord intact. And when you're sleeping in this position, what happens is you will get enough oxygen to the back part of your lungs. So don't stay in this position for a prolonged period. Maximum we say 1 or 2 hours. And then what you do is you're going to tilt to your right. When you're tilting to your right, now I'm going to need an extra pillow. Keep this here. This can go away. One pillow in between your knees, one pillow here, and then slightly rest. This when you're sleeping to your right side. And then you breathe normally. After this is done, after a couple of hours, then as I showed you before, then you keep your pillows into a triangle, and a pillow on top. Rest. Keep your arms like this open. Don't hunch. Always keep it open so that just this expand and you'll be able to get enough oxygen while resting. And the same way, once that done, you can the same thing what we did to your next side. Okay. So these positions you can repeat every 1 or 2 hours, like I did, starting belly down, then turn it to your right, upright, and turn it to your left. Now, as I advise, if you are medically advised to lie down, please continue doing that. But if you're just normally and recovering, try to get on these positions of doing things. It will help you be easy and coming out of from shortness of breath and improving your breathing properly. Now, before I wrap up, I'm going to show you slight exercises you all need to do. As you all have heard, or maybe you all have saw videos how people recovered from COVID and try to go to the gym straight away and starting to work out, and there are people who have collapsed and loss of lives. And not only abroad, even in Sri Lanka also we have seen where people have collapsed, even running and walking soon after COVID recovery. Because once your body gets damaged, when your internal organs get damaged, it takes a certain time period to get back and to regain your strength. And therefore, for each person, it will be different. But in the same way, always don't ever skip that rehabilitation recovery process, because everyone is needed. For an example, national athletes, when they get COVID, they are finding it hard to come back even after 1, 2, 3 months resting. Just imagine as general public, as you and I, how we have to take care of ourselves and come back to our normal lives. So the thing that I'm going to show you all is there's no age gap or age difference. Even you can teach it to your parents, grandparents, old or young, anyone can do it, and anyone has to do it if they want to regain and come back to their state. So the first one we are going to do is we're going to warm up ourselves. What we'll do is you're going to relax your shoulders by circulating them forward and back. And then we are going to circulate them forward and back. Once you do that, I want you to keep your hands like this, fingers pointing forward and stretch. While doing this, I want you to breathe naturally. Come back in. And once you've done that, what you're going to do is, I'm going to link my fingers behind. I'm going to show you like this. And I'm going to stretch back, expanding my chest. Once that's done, first thing what we're going to do is we're going to do something. What is the most general thing you will be doing? Getting off bed. So it's a simple thing of getting down and coming back. So now if you have now here we have a high bed, but if you have a low bed, what you've got to do is basically you're going to come back in this sitting position. Don't try to do any movements, and then you sit back on the bed. Come back and stay in the position, and then you sit back. Repeat that 3 to 5 times. And while doing this, if you get a cough, if you feel lightheaded, dizzy, please stop. There's nothing to worry. It's just that you have, you're recovering, you're coming out of COVID, and nothing to worry. And don't continue, even if you sometimes, I always say, men, sometimes they have this ego, okay, I can do this. No, please rest. Rest is one of the best exercises. So if you feel shortness of breath, you sit and you get up. And if you feel shortness of breath, lightheaded, dizziness, rest. So after the sit and getting up, what we're going to do is we try and do slight marches while sitting on the bed. Slowly, and don't rush through this. Don't try to go very fast. If you have all the time, you're going to repeat this. And once you are comfortable doing this on the bed, then the next one is we're going to come out from the bed in sitting position, stand upright. Go back to the bed, sit, come back, upright. And then gradually when you feel that you are comfortable with these things, then you can go to a static march. Just getting your body loosen up, joints moving, and steady breathing. Don't try to rush it. You're not going to, this is not high knees, this is a static march to get your joints moving. And once that is done, there are a few things I would say if you can do it on your bed, especially the stretchers. Okay. So once you relax on the bed, one of the best exercises you can do is for your lower body and your bottom. Get into this position, neck bent knees, lying down straight, and you can use one pillow for this, and hands placed down. So once you're down, while breathing in, you're going to put pressure to your heels and lift your lower body into this position while breathing out. Ideally, if you can do this while breathing in from your nose and exhaling from your mouth. In exercise terms, we call it, but I don't want you to lift it so high. Always lift what you can. If it's this much, that's fine. If you can go more, that's fine. So maybe do 3 to 5 reps of this. And then the most important thing, I would say, while you're stretching your legs, is the clot release. So while you're going to do this, I call it the calf pump. So what you do is you point your toes all the way and then bring them back. Because when you immobilize and when you're not moved for a longer period of time, there can be clots generating from your lower body and traveling to your upper body. We have to prevent that from happening. So what we do is do a couple of stretches. Point your toes towards forward and then bring your toes back again towards your head. While doing that, you are going to increase the blood flow towards the calf muscles and the lower body, and you'll be clearing the clots. And then once that's done, if you can just pull your leg back towards your chest. Deep breath, release. Deep breath, release. And then again, you can go as I showed you for the previous one, which I did. Breathe in, breathe out. And once, as I said, if you're doing this, if you fall short of breath, always remember to rest. If you feel light, always rest. And always, as you finish the exercises, get back to your sitting position, stay upright, hold your diaphragm right under the rib cage. Make sure to do your deep breath. Now, how much you need to do these exercises? I would say 2 to 3 times a day. But depending on the medical advice you have given and according to your condition, please follow it. With that, If you're able to do it only once, it's fine. Remember, it's a process of getting back to your normal lifestyle and normal livelihood. So, and talking about the atmosphere of the room once you have been locked, it mentally can affect you. The little things what you do is always try to keep your room clean. Maybe you can get someone's help from the room and have like fresh aroma of cherries, maybe a burning oil lamp, because that aroma creates a lot of things mentally and emotionally as well. So those certain things matter, those small points. And after that, we're going to touch on nutrition as well. We have our expertise. And once again, I want to thank Vida for giving this opportunity to share. And hope you stay safe and stay fit.
Thank you, Mr. Nigel. To our audience who just joined in, I would like to welcome to our post-COVID recovery program, let me say the webinar. And also, if you missed the first part of the webinar, you can always catch the video of the program that you missed on our Facebook page. The live video will be out after this session. And if you have any questions, do post it on our chat or even on our Facebook comment page. And also to introduce our next guest, more to say our nutritionist at Vida is Dr. Madhushan Nagasinghe. He is a medical nutritionist, and he will be advising and giving you tips on improving your nutrition after getting COVID. Thank you.
Okay, good morning. I think you all can hear me. Is it clear?
Yes,
Hello?
Doctor, you can start now.
Yes. Actually, I'm joining from my home. What my area, when I'm going to discuss about the nutritional aspects, it is not much of a difference when you consider pre-COVID, during COVID infection, as well as post-COVID. So, let me start off. First, we all know that COVID is due to an infection due to a viral virus. So the body's mechanism is to cope, to fight with the virus and to get back to the normal life by using the immune system. So nutrition plays a very important and pivotal role to combat this problem. So there's no cure up to now, only we have the preventive vaccines and other symptomatic treatment. So we have to boost our immunity, and nutrition is one of the paramount things to improve or boost our immunity. So I will give you a few tips you can do that, and this will be helpful for you to prevent, as well as if you have got the disease, and to overcome this what is called the post-COVID syndrome. Sorry. So first of all, I'll start with sleeping or resting. Sleep or resting is a very important factor to boost our immunity. We need at least an average adult needs to sleep at least 6 hours during night time. Means at a stretch you have to sleep for at least 6 hours. So if you don't sleep or your sleeping pattern is erratic, hormones like cortisol and other stress hormone levels can go up. So your immunity will go down, and you will be more prone to infections, not only viral infections, any other infection. So sleeping and resting is important, especially if you have got the disease And during the post-COVID or when you are disease-free period, sleep and resting is very important. So second thing I want to tell you is about drinking plenty of water, adequate water, uh, because our body has a lot of metabolic functions, like our heart is working, pumping, and the respiration, the lungs are working to get for the breathing in and out. So for those things, even your kidneys, your liver, and other brain function, everything you need energy, and that is called metabolism collectively. So for that, an essential component is water. Usually, an average adult will contain 50 to 60% of their body comprises of water. So you need plenty of water to uh, maintain your metabolism. So uh, if we to calculate the amount of water we need per day, it is simply calculated as weight divided by 30. For an example, if you are a 60-kilogram person, you have to divide it by 30. So 60 divided by 30 equals to 2. So 2 liters per day you have to drink. It is a direct water. I mean, apart from the liquids and other gravies you take, directly you have to at least drink that amount. And now, when we talk about this COVID period, so you can drink a little bit more than that. That is the usual average amount we need. So during this period, if you have the disease, if you have got the disease, or you are recovering from the disease, you can go for a little higher volume than that. And even when you consider children also, it depends. Say if a child between 1 year and 5 years, you can give the child about 500 to 1 liter per day. If the child is 5 years to 12 years, you can give about 1 to 1.5 liters. So if the child is going towards the adolescence from 12 to 18, you can even go up to 2 liters per day. So keep you hydrated. That's very important thing. And avoid those uh, zero nutrient freezy drinks, those carbonated drinks that won't help. So drinking water and other fluids like kanji, then jeevani, the oral rehydration solution. So you can keep your hydration as well as your electrolyte, the sodium, potassium, the salt levels also. So the third point I want to tell is about exercise. So Nigel beautifully explained about the breathing exercises and how to keep your body at a good shape. And apart from that, the usual recommendation is for adult to walk at least 30 to 60 minutes per day for about 5 days per week. So you can do that. Now you might say, now it's lockdown, we can't go out from the house. But I advise my patients, you can always divide that 30 minutes into 3 segments. Like after breakfast, you can walk for 10 minutes within your house or your garden. That would be enough. You don't need to run, jump, or do any other things. Just walking would be enough. 10 minutes after breakfast, 10 minutes after lunch, and 10 minutes after dinner. So that would be sufficient. That's the minimum. And if you want to do a little bit more, you can even do swimming. If you don't have any joint pains like knee problems, you can do cycling. And also, if you want to run, the best method is to run on the beach, so that won't affect any joints. So apart from that, if you are talking about children, what they say is children should uh, actually play, run here and there, play for at least more than 1 hour per day. Uh, Actually, all the days of the week. That's what the recommendation is. So same things can be applied during this COVID infection as well as post-COVID period. And the other thing I want to mention here, it's advisable to get a doctor's opinion before you do cardiac uh, those high-end exercises, or say weightlifting or other resistance exercises. So it depends on the person and how you have recovered, and the level of fitness depends on that. So it's always advisable uh, to walk and do the day-to-day work. But if you want to do something little bit higher energies consumed, you have to. It's better to get a doctor's or a physician's opinion. Right. So I will come to the proper of nutrition. So nutrition, we all Sri Lankans, we take snacks. So I will give few tips. First thing is you have to
Well, I think there have been some technical issue on Dr. Madhush's end. We have a couple of questions coming in as well. If you have any questions, do.
Can you hear now?
Yes, doctor. Yes, we can.
Yes.
Thank you. So we have a couple of questions ready as well. Just use some chat box to type in your questions for us as well. So we'll get them to the doctor.
Shall I continue?
Yes, doctor, please.
Yes. Okay. Then the nutrition proper. All you have to 3 main meals and 2 snacks. I will tell you what snacks are later. Okay. The three main meals, usually we have the carbohydrates. The Sri Lankan meal, usually about 50 to 60% is other starchy vegetables, and the grains. Those things contain a lot of starch. So, and we take a very limited amount of proteins, oil, as well as vegetables. So during this period, now we all are talking about these immune boosting vitamins and minerals, those things, but we have forgotten the basics. So you have to take at least and 2 fruits per day. Now, when we do surveys, we have seen that take at least 1 fruit per day. Actually, we have to take at least 2 fruits per day and 3 vegetables per day to make a good variety. So that would be more than enough to give the daily requirement of vitamins and minerals. And also, I talked about the proteins. The rich sources of protein are the meat, fish, and egg. Egg is not a very rich source of protein, but compared to that, meat and fish will give a lot of protein. And if especially the elderly and people who do picky eating or vegetarians, they will consume less protein. So you can ask them to eat a lot of legumes, pulses like dal, those things, the kadala, the chickpea, those things, green gram, those things can give a little protein, but they contain more fat, the starch, but less protein. But come what may, they can get some protein from that. And also soya products like soya meat, You can take those soya seeds, soya added, those things. And also there's a product called tofu in the market. You can take, that's a product. So you can ask them to take that. So apart from that, so I talked about vegetables, fruits, protein and oil. Oil, of course, it's a little bit of a concern. So it's always good to temper with oils that are not containing coconut oil or palm oil. So for tempering, you can use other oils like sunflower oil, canola oil, saffron oil, soya bean oil, so on. But for deep frying only, it is better to use coconut oil. And also this coconut milk, polkiri. So that is sometimes we abuse a little bit. So for average Sri Lankan family of 4 per day, you can use 1 coconut. So that's the recommendation. So if you are using more than 1 coconut per day for a house of 4 to 5, so that means you are consuming more fat. So be aware. And the other thing is the cooking methods and all. So with the interest of time, I can't go into details of that. So it's better to prepare and eat freshly prepared foods, especially to keep the nutrients, especially vitamins and minerals. So daily you have to cook and eat. And you had, with the lockdown and all, it's difficult to buy daily things, but so you can use methods to you can cut and keep the things freeze to use it later on, keeping the nutrient values without damage levels. So finally, I would like to tell about these vitamin supplements a little bit. The commonly used one is the vitamin C. So someone has told me to off your video. Okay, I will off my video then. So hope it's clear now. Right, now when we talk about the vitamin, the tablets, the vitamin C, vitamin D, zinc tablets, so on. Now, if I were to tell about vitamin C, the usual daily recommendation is for a healthy adult, you need only 90 to 100 milligrams of vitamin C. So that amount is very well supplied if you take daily 3 vegetables and 2 fruits. So you don't need any vitamin C from tablets. But there are instances that we as doctors we can prescribe for special reasons. But taking vitamin C capsules without
I think Dr. Madhush will be
doctor's
joining us
advice
again.
would not help. I mean, it will not boost body. But if you take excessive vitamin, it will pass through your. Okay, there was a small problem. Did you hear what I told you at all?
Doctor, if you could repeat that, that'd be great. Thank you.
Yes, I was talking about vitamin C, and you can take vitamin C supplements based on doctor's recommendation. Apart from that, you can take you can get vitamin C to your body by just consuming at least 3 vegetables and 2 fruits per day. So that was that was what I was trying to highlight. And the other thing is vitamin D. So we as a country near to the with proper sunlight, so at least 40 to 45 minutes of sunlight exposure day will provide adequate vitamin D levels. But if you are a dark skinned person, the vitamin D production will be lesser than a white skinned person. So that is also recommended only after prescribed by a doctor. Vitamin D, vitamin C, don't take unnecessary because the side effects, of course, is very minimal, but you are like spending unnecessary money. So you can take those things from food. Especially vitamin D is very abundant in the milk products, especially fresh milk, cheese, yogurt, and so on. And the other thing is zinc and other minerals. Yes, zinc is also available in food, especially seafood, the meat, fish, and those things contain a lot of zinc. So what my advice is to take plenty of like the things that I mentioned, so you can uh, fulfill the nutritional needs, the vitamins and minerals with food rather than uh, taking the vitamin supplements. Those can be taken only after recommended by a doctor. So that is what I was planning to tell you. I have a lot of things, but with the interest of time, I will stop here to give chance for people to ask some questions.
Thank you, Doctor. I think we have a couple of questions that are coming in. Indrani Costa is asking this question. Doctor, I think can answer this question.
Yes.
Her problem is that she can't sleep. She's not having enough sleep. What would you recommend for her?
So sleeping disturbance, she has got the disease or what? Is it due to some other reason?
Yes, she's a
She has
recovering
not
patient.
met.
She's a
Sorry?
recovering patient. She's a
A
recovering
recovering
patient.
patient. Okay, okay. So sleep disturbance, I mean, what we medically we call insomnia, has three components. Usually one is difficulty in falling asleep. That is one category. The other one is when they go into sleep, but they can't maintain the sleep. The third category is they fall into sleep, they go into sleep, but when they get up from the bed in the morning, they again feel sleepy. So I think she's having a problem with going to sleep and maintaining, probably that. So yes, it has been in the literature. They have mentioned such patients post-COVID syndromes, that, as they mention in broad terms. They have mentioned uh, a problem like that. So, but the thing is, I can't directly tell a solution because we had to evaluate. We had to see things like her hemoglobin levels, thyroxine levels. Is she obese and she's having some problems like obstructive sleep apnea? So I have to evaluate those things, and I have to exclude those things first to give a drug or to come at a diagnosis. So it's difficult to give an answer at this point. It's better to consult a doctor or a physician.
Thank you, Doctor. I think Dr. Chandana is ready with the other questions. I'm going to hand it over to Dr. Chandana now. Thank you.
Okay.
Thank you, Malan.
Okay, thank you.
I think we've got quite a few interesting questions. Most of them were concerned about sleep issues. As Dr. Madhusha explained things clearly, sleep is an important factor in recovery, especially after an illness. And maintaining sleep, falling into sleep, and getting a proper sleep are concerns need to be addressed by a medical professional. You need to seek medical assistance if you have a continued difficulty. Of course, if you followed the full program, I'm sure the physiotherapy part of it, the trainer showed you how to sleep, how to do a few breathing exercises before, after dinner, before you get to sleep, and so on. If you try those, most of the problems will be addressed, I think. But at the same time, if it is continuing to bother you, you need to seek medical assistance. Among the questions, there are a few. There are hundreds of questions, and most of them, I mean, we have summarized, and they have been asking, what is the first thing I need to do if I get sick? Someone gets sick. Seek medical assistance. If you feel feverish, if you are not a diagnosed COVID patient, or even after being diagnosed and cured after 14 to 21 days, still seek medical advice. You don't wait. But the tiredness, the fatigue, the myalgia, muscle pains, the mild cough, all that, you need to know are not signs of COVID pneumonia, or you're not in the wagon. You get such a phobia, which is going to psychologically stress you and bring you down. This psychological component of me being strong enough to fight COVID is a huge factor influencing the outcome and the recovery. So that is one of the main concerns, that you need to understand that COVID is just another viral infection. If you are healthy, and even if not, if you have other comorbidities, still you need to know that if I control myself, if you're a diabetic or a hypertensive, a kidney disease patient, if I control myself right, if I take my other medication right, and if I do the right thing, the nutrition and the rest, and looking after post-COVID fitness, you can get back to your pre-COVID state without any difficulty. People who have had issues, major issues going into COVID pneumonia status, need to definitely have follow-up with a medical professional for further care. So getting sick, see medical assistance. Not getting enough sleep, I think we have addressed that. At what point do I get back to training? I think physical training they're talking about. I'm sure Nigel will be able to tell us more on that. But we need to know that physical training need to come to the scene only once you realize that your general normal day-to-day life is established. You need to walk, and walk. As Dr. Madhusha correctly said, you need to understand that half of our blood supply when you are standing erect is to your body's blood supply is on your lower limbs. So if your lower limbs are kept active, your system, whether it's circulatory system or the pulmonary system, will work right. So walk, and walk. I'm sure Nigel will tell us how you gradually get on to real physical training. I mean, he's training international athletes and sportsmen, so he will be able to tell you more about that.
Hi. So as doctor said, and as I explained, this is a common question of, people who have been gymming, in the fitness world we call the fitness freaks, and then, the fit moms and everyone. What thing you need to realize is once you get COVID, whether you have been fit or whether you have been an athlete or even a normal person, your body is going through infection, and it's like a wound. So I would put it in this way: your wound gets healed, it takes time. And imagine how that is when your internal organs get damaged. So the question was, how long does it take for me to start my physical training? So how you start is you have to see, as I said, to do the deep breathing exercises and see whether you're comfortable with it. Then the next stage, can you breathe in deep, hold it, are you comfortable in that stage? And then your day-to-day work, walking up and down the stairs, sitting and getting up from a chair. those things, you see, you have to do it without, being, if you're not getting, if you're not lightheaded, if you're not getting shortness of breath, if you are comfortably doing your day-to-day work, as doctor said, walk. No, you don't have to have a particular distance or a time duration, but start with 3 to 5 minutes. Now we say in 3 minutes, if you're feeling tired, please stop at 3, go back home, or even if you can't go back home, find a way or call your loved ones to get back home. Don't try to go beyond like, I can do it. No. Your body gives you a signal to rest, please do rest. There's nothing wrong with it. And gradually you increase 3 minutes, 5 minutes, 10 minutes, 15 minutes. And if you can walk, and if you're comfortable with it, then you brisk walk it. And gradually, when you feel like you are comfortable with your breathing, you can take a flight of stairs up and down 2 to 3 times, you're not running out of breath, then you start on the slow aerobic exercises. Now, the slow aerobic exercises, when I say aerobic, the word goes, you're doing the jumping jacks, you're doing the mountain climbers. No, the slow aerobic exercise is static march, maybe a little bit of punching, circulating, and when you do those type of movements, and if you're feeling comfortable, then you start with low resistant training. Now, when I say low resistant training, still I'm not talking about added weights. I'm talking about using your own body weight, like doing a squat from your own body weight, and then maybe a lunge from your own body weight, and then gradually only you're going to say, now for me, this especially for guys, the guys have this thing of doing push-ups. So if you are after COVID, don't exert yourself from going down straight and doing a push-up. Try to do an incline push-up on a bench or a chair, and then you increase your difficulty. It's like how you went to the first day to the gym. And always remember, there's nothing wrong starting from the ground to get back to where you were. Because in recovery, there's no shortcuts. So once you feel that you are back and your normal day-to-day life, you are capable, you're not running out of breath, you're not fatigued, then you slowly start gymming or whatever training, like you started gym on the first day with lower reps, lower weights, and then gradually increase.
There are so many questions. I'm sure, Nigel, you need to address this as well. Somebody is asking, after 3 weeks, he started light stretching and half a kilometer walk. Is this okay? I don't feel tired. What would be a good period to go on a regular walk? I think Nigel has addressed the question very clearly with this previous answer. There are a few other interesting questions. Now, we wanted to finish it in 1 hour exactly, and it's past 12. So if you can drag on, there are a few very interesting questions. So I think it's worth hanging on for another 10 minutes. And I'm very happy with the interest shown in this. Sleep was a major concern. Getting back to exercise was another concern. And there is a question, how long does it take for the lungs to recover for an infected person? If you haven't been symptomatic, there's no time taken. They will not even know. Most of us will not know even that we have had the infection and whether we have recovered. Now, when you are talking about lungs, the answer, the real question is, how long would it take for you to get back to your social feeling, panting after a few steps and climbing upstairs and doing a bit of a walk and so on? Those are the concerns I see as a primary care physician most of the time. They come and say, Doc, I walk from the car and get my bags out, then I feel tired, which I was not before. So you need to know that when we put in a patient in an intensive care unit, ICU, we start on physiotherapy straight away. Why? Because the patient is bed-bound. All the muscles, joints will not work normally. So that the lungs need not supply oxygen to all those. They need to supply only to your essential functions like breathing, heart muscle work, and the kidney functions and so on. So unless you be active and you gradually improve your activity, then only you get back to your normal self. So expect those. I've been quarantined twice after getting exposed or possible exposure. So being room bound for 14 days and getting back to your normal self is going to make you feel tired, because I'm somebody who's carrying my medical bag from this patient to that patient, from this clinic to that clinic. And when I'm room bound, I go only from the bed to the washroom. And then after 2 weeks, when you get back to your normal self, you feel tired, you feel exhausted, you feel that you're not normal, you don't have that good old strength to get back to normal. This is an accepted norm. Be prepared to accept it. And unless you gradually work on it, like the breathing exercises Nigel clearly explained, you will not get back to your normal self fast. It will take time. And if you're obese and if you are very lethargic, if you don't have the right nutrition, like Dr. Madhusha explained, you will not get back to yourself fast. As I told you, there are interesting questions. There is one question where they have mentioned a trade name. I know that everybody is asking me at my clinic also, is zinc, I will not use the trade name, is zinc recommended to be taken daily for 3 months after COVID? Depends on, Dr. Madhusha clearly explained, if you have the right food, right meat. Vitamin C, zinc, and vitamin D, of course, are known to boost your immunity, not against only COVID. Any viral infection, these vitamins are helpful in boosting your immunity. And getting the right dose of vitamins and for how long it is required is your doctor's decision. Get your medical practitioner to decide on that. But having a little bit extra is not going to do any harm, but not for long term unnecessarily, because pharmaceutical trade and the medical profession is flourishing these days with different multivitamins. Actually, that is why we wanted to address this with a good heart, to make
Yes,
people understand that
Dr. Chandana. Yeah,
is
I'm
not.
Madhushi, and now it's.
Yes, Madhusha, go ahead.
Yes, yeah, that's a good question about the zinc supplement. It's now like a fashion, no? They're asking a doctor, that doctor has given this person this thing. Is it okay for me to take, and is it good to give to my family like that? It's like අර ඒක නිකන් නැත්තුව බෑ වගේ something like something has something is there in the society. So that's a very important thing to understand, that everything is not suitable for
everyone. That's it. Thank you, Dr. Madhusha. Then මම පැහැදිලි කරනවා නම් ඒක තවදුරටත් හැමෝම හිතනවා විටමින් එකක් හැමදාටම ගන්න එක හොඳයි, දිගටම ගන්න එක අවශ්‍යයි. ලෙඩ වෙලා ඉන්න වෙලාවට කොවිඩ් කියලා ඩයග්නෝස් කරලා තියෙන වෙලාවට සති දෙකක් ගැනීමේ මම හිතනවා ලොකු ප්‍රශ්නයක් වෙන්නේ නැහැ. හැබැයි නිකරුණේ මුදල් නැස් කරලා සියලු දෙනාට මේ විටමින් එක ගන්න ඕනේ කියලා හිතන්න සහ දිගටම ගන්න ඕනේ කියලා හිතන්න අවශ්‍යතාවයක් නැහැ. සම්පූර්ණතා තිබුණ නැත්නම්, if you haven't had any complications of COVID, you don't have to unnecessarily be going on medicine. Why I wanted you to be online was to answer these interesting questions. I'll leave the most interesting one as the last question. There is another question they ask, after COVID, is it required to have a full body checkup? A full body checkup or medical screening is required to maintain health. After COVID, unless you have had any complications, you don't have to unnecessarily go through a whole heap of investigations. There will be so many suggestions, so many social media requests, but your medical professional, your family doctor, your primary care physician is the best person to identify what is exactly required and to go through it. Having a medical screening is important for people now who have, somebody who has gone through to COVID pneumonia will definitely need a high resolution CT scan of the chest, HRCT of the chest. But for somebody who has had a mild dry cough, need not go for a HRCT. And HRCT is something where you expose yourself unnecessarily to a huge radiation. And those radiations have known to give rise to certain other side effects, known, identified side effects. So we don't expect people to unnecessarily spend on those investigations and go through a whole heap of
Yes,
tests.
yes, Dr. Chandana, you can tell, yeah, it's like one CT is like taking 400 chest in the X-rays, no? It's
Very good. Yeah, I think that's the way to communicate. Now, there are people who request me to have a HRCT as a primary care physician. I cannot, as a medical professional, unnecessarily prescribe those. As Dr. Madhush correctly said, it is like exposing to 400 X-rays going through one HRCT. But when it is required, if you don't do it, you also can be in trouble. So let your doctor make the decision. Also there is, we'll make it the last question. I think we have gone beyond the expected time duration. There are questions, many are questions asking whether there are restrictions for sexual activity during or after COVID. During COVID, as I told you, medical science is evolving, and we are looking at, as I told you, there is no expert, and we are still studying. And if you ask me whether during COVID, whether you can have sexual activity, answer is preferably no, because we want you to maintain social distancing, and we don't know whether, mostly we don't know whether you and your partner has got the same COVID variant and so on. And after COVID, of course, once you get back to your normal day-to-day life, sex is a part of it. You all can, of course, have sexual activity. Sex is one of the best cardiac exercises. It is identified thing. So getting back to your sexual activity, like the pre-COVID days, is worth important, and also is a good exercise, physical exercise. Having said all this, I am going to conclude. So to summarize, you all didn't know that how to sleep, how to do basic exercises.
Before you sum up, you have to tell the community that there are no drugs available at the moment to cure or prevent the disease. In social media, there are lots and lots of drugs, products, individual doctors, expertise. They are telling the, you must have seen, no? So whatever said and done, you must always follow the correct guidelines, and whatever the correct authorities, what they issue, the people who are authorized, what they tell, you have to take. Don't go behind these what you
Social
call
media and individual opinions.
Yes, exactly. So yes,
there
that's
are
my
a
final
lot of experts who come on social media and talk about their personal opinions. Of course, with all the due respect to those senior consultants and professionals, I think the medical profession has evolved on evidence-based medicine. Allopathic medicine, what we practice is evidence-based. So we cannot haphazardly, apply individual thinking into medical practice. So what we want is for it to be very scientific, evidence-based. So in time to come, what we are against today, we might be in favor, science change. And it has to be evidence-based. So thank you, Dr. Madhusha, for highlighting that, because there are so many people coming out with different drugs, and some people self-treat themselves and get into trouble. And I've seen so many recovering, so many dying with their self-medication. So
and to
that's a big.
And to do the vaccination. That's the only
Yes,
thing that
I was to end the session with that. Yes, go ahead, Dr. Manisha.
don't think about the
Yeah.
brand or the type of vaccination. Whatever the vaccine you get, you have to take it. There are no superior or inferior vaccines to date. So whatever the available thing that is given freely from the government, please go and take the vaccine as soon as possible. That's my final word.
Yes. To sum up, that is what I wanted to end up with. You need to understand COVID has no proper medication to cure or kill the virus yet. All what we know is to do the supportive therapy, including oxygen, to everything what we do are supportive things for your body immunity to fight against it and do it. Only one way that we can tackle COVID is by vaccination. Now, our colloquial mindset, පරාදීන චින්තනය අපිට දීලා තියෙනවා මේ රටින් එන එක වඩා හොඳයි මේ රටින් එන එකට වඩා අධිරාජ්‍ය ගති මානසිකත්වය අපිට දීලා තියෙනවා දාන වැඩි නම් හොඳයි මේ රටින් එනවා නම් හොඳයි අර රටට වඩා ඒ කතන්දර සේරම අවශ්‍ය නැහැ ලෝක සෞඛ්‍ය සංවිධානය World Health Organization has approved vaccines and we are in a country where we are blessed. Whether you are rich or poor, you can get the vaccine. Of course, there are influences and difficulties in getting the vaccine straight away, but it is well worth you getting the vaccine, and that's the only way out of this. මේ සියලු ක්‍රියාදාමයන්ගේ මේ lockdown වලින් මේ තියෙන බෙහෙත් කරන ක්‍රම වලින් සියල්ලෙන්ම කරන්නේ සෞඛ්‍ය සේවය health sector එක overload වෙන එක අමරට වඩා දරා ගන්න බැරි මට්ටමට එන එක වළක්වලා කල් දමා ගැනීම විතරයි. එක්කෝ අපි සියලු දෙනා ඉන්ෆෙක්ට් වෙන්න ඕනේ. එහෙම නැත්නම් අපි සියලු දෙනා වැක්සින් එක ලබා ගන්න තියෙනවා. ඉතින් අපේ රටේ මිනිස්සුන්ගේ කියවීමේ හැකියාව ලිවීමේ හැකියාව ඉතාම ඉහළ මට්ටමක තියෙන්නේ. එහෙම රටක බොහොම පහසුවෙන් මිනිස්සුන්ට දැනුවත් කරන්න පුළුවන් දැනුවත් වෙන්න පුළුවන් ඒක තේරුම් ගන්න ශක්තිය තියෙනවා. එන්නත ලබා ගැනීම තමයි කළ යුතු ප්‍රධානම දේ. And Dr. Madhusha කිව්වා වගේ හම්බ වෙන පළවෙනි එන්නත. Grab the first opportunity. No vaccine is superior to other. එකකින් superior වෙනකොට තව එකකින් inferior වෙනවා. So grab the first opportunity and take the vaccine to protect yourself. Thank you very much for attending this webinar. We are trying to do a few others. Actually, we wanted to have a consultant pulmonologist involved. But as you know that most of the respiratory physicians, pulmonologists are extremely busy these days. So we are going to have another webinar in time to come. Thank you very much for joining and thank you our panel, Dr. Madhusha and also Nigel for joining us. Thank you Vida for organizing it. Marlon, yes. Thank you for coordinating all that. Thank you all for attending and getting your some of the basic concerns resolved. You have a good afternoon.
Yes, thank you. Stay safe and stay healthy.
Thank you, Doctor. Thank you, everyone, for joining us on Sunday. You can also consult Dr. Madhusha and Dr. Chandana and also Mr. Nigel through VIDA for any sports-related and nutrition expertise. And Dr. Chandana, in fact, is our in-house family physician. So if you have any inquiries, do visit our website, www.vida.lk, and stay tuned to our socials as well. We will be letting you know the dates of our next webinar. So have a great day, everyone, and do stay safe. Thank you.